introducing Staffbase really changed the way we communicate on a day-to-day basis. My name is Richard Mills. I am the Director of Corporate Communications at Bethany Children's Health Center. Introducing Staffbase really impacted our entire organization because we did not have a form of communication before that. We used email for most of our communication. And for a hospital like ours that has a lot of content, a lot of stories to tell, a lot of inspiring stories, that is, it was important for us to have a place where we bring all those stories and all that content for the staff to see. Before Staffbase, it was just, we never communicated because you didn't want to flood someone's inbox with too many emails. And so instead of doing that, we just didn't communicate. And that's not effective in a hospital that has over 900 employees. And so that has really changed the way we communicate. I think that has been the biggest impact so far. The intranet, which we call Buscom, really allows us to have all the content in one place. It gives the different departments a place where they can also host their content as well, specific to their department. But it brings everyone together, inspires the staff, the stories we tell, the pictures of kids getting to go home. That really has changed the hospital dramatically because we didn't have that before. And we knew we had the content, we just didn't have a way to share that content. And so introducing Staffbase really changed the way we communicate on a day-to-day basis. It allows staff who cannot get to that information in real time, especially nurses who are always on the floor working to take care of these patients, don't have time to be behind a computer or their phone 24/7, to go back, know exactly where they can find that information, not have to scroll through emails all the time, go to a special hub on the intranet to know where to find specific information. That has really changed our efficiency. I think it allows staff to really have more time to do the work that we do because they know that when they want information, they know exactly where to go. I think that it has enhanced the way that our leadership communicates with the staff as well, because that's an important part. Working in healthcare is hearing from your leaders and knowing that they have your back and that they care about your mental health. And that's something that we've been able to do with Staffbase because our leaders communicate often. Our CEO communicates twice a month through Staffbase, through our intranet, and that has really inspired our staff. And so I think that has been the greatest success, really, is seeing the impact that our leadership has just through communication. This intranet has really changed the way we communicate because you see our leaders being active in the day-to-day work that we do, and that has really changed the perspective staff has about our leaders, and that's really been a success for us. So our facility is really a place where we help maximize their potential, whatever the potential is. You know, a kid who may not be able to speak and speaks for the first time, that's potential. And so being able to maximize whatever that patient can do, whatever that child can do, is really what keeps us going. And that's what really inspires our staff. That's what inspires me. And that's really the work that we do. It changes the lives of a lot of families and a lot of kids. So, and it changes my life as well. To be able to inspire and keep staff connected about happenings around the hospital, things that they need to do to make their day easier. You know, working in healthcare is not easy, so whatever we can do to make the work day for them easier by communicating and keeping them on track really makes my day, to see that we're helping them in order for them to take care of the patients who need to be taken care of. So that's really my favorite part, is really inspiring the staff to take on the mission of the hospital, which is to maximize the potential of all children.